exaggerate.
Yeah, we were looking at the before and after this morning, and we couldn't believe the results.
And oh, the things they can do these days to help us look younger.
Yeah, we're talking about erasing the frown lines. You know, your mom told you don't frown because you'll get those lines in between your eyes. Crow's feet, the nasolabial folds, those things right here.
We've talked about those before.
That's right. Lip lines, we're talking about all that. Dr. Deborah Manjoney is here along with Arleen of Ferrall from Wisconsin Vein Center MediSpa to tell us about the innovative techniques being used today. Welcome, ladies.
Thank you.
Yeah, and we were talking about one of the newer terms that is being used is called the liquid lift.
Yes.
And that's what we were looking at in the before and after shot just a minute ago, right?
The liquid lift really can accomplish quite a bit. Yes, it's sort of, you know, as you get older, you lose some of the facial structure that the fat had given us when we had baby fat as youngsters and teens. And when that diminishes, sometimes the whole face just kind of droops a little bit. So by adding back that volume that was lost over the cheekbones or under the eyes and, you know, and down in the chin and all, you can really accomplish a lot.
And when we're talking about the fillers that you use, is it just Botox we're talking about? Because there are a lot more products out there that are kind of new and improved, right?
Well, Botox is actually a purified protein that we inject right into the muscle to relax the muscle. Therefore, it relaxes the lines and wrinkles as well. Fillers, we fill in depressions and folds in the skin with substances. But the Botox relaxes the muscle and it smooths out the appearance, especially the lines on the forehead and around the eyes and in between.
Because it's that plumpness that gives us a youthful appearance,
right? And that's really the fillers.
Okay.
The Botox will help get rid of the upper face wrinkles, as Arleen was explaining.
Okay.
Which really, that frown line that our mothers told us not to frown, your face will freeze.
I think everybody's heard that.
That's right. Yeah. But the fillers really are volumizing. And so there are several new types of fillers that are available today, hyaluronic acids and calcium hydroxyapatite, that replaced collagen, which was kind of the filler that was used for many, many years, but was much shorter lasting. Now fillers can really last quite a long time.
Get up to over a year with fillers.
Really? Because we had heard like 3 to 6 months or something, but now up to a year.
If you get a touch-up within 6 months, it can last over a year.
Wow.
Yes. So especially the second time when you build on it, it really does last and helps rebuild your own collagen.
Absolutely. I think your experience is really key to what sets your med spa apart from some other ones. Tell everybody kind of your background
a vein center in MediSpa, and I'm a cardiothoracic surgeon. So for about 18 years, I did open heart surgery. And then I decided that as I was aging, I felt that colleagues of mine and other people who are aging might also want to be able to keep themselves looking good without necessarily going through plastic surgery. And we were able to offer some wonderful treatments for varicose veins and spider veins because of the new innovations that had come out with laser treatments. And I just thought we should expand that to aesthetics. And so we started looking into other things that we could rejuvenate the skin, and we could offer things that really could be minimally invasive or non-invasive with no downtime, so that people could have treatments and no one would have to know. They could walk out and actually get the benefit of having true improvement in their skin, as well as getting that youthful appearance back.
And when you talk about veins, particularly in the legs, I wonder, how does somebody know if it's something that's cosmetic or if it's something that might be the sign of a medical problem where maybe their insurance would be more likely to cover it?
Well, with the bulging veins, those are usually insurance coverable. They're medical they'd be a medically treated process if somebody has symptoms. So really, the insurance companies really require that someone's symptomatic from varicose veins, and probably about 70% of people are. So, and they may not even realize that the symptoms they have in their legs are from the varicose veins. If they get very tired at the end of the day after standing long periods of time, or they have restless legs at night, or leg cramps in the middle of the night, those can be signs of congestion in the leg caused by varicose veins.
Okay.
And what I love too is that you're always there.
Yes.
And I think that's key too, that there's always a doctor there when you're getting even the most minimally invasive procedures done.
That's very true, and our staff is so well trained. I have Arleen, who is a nurse practitioner. I have another nurse practitioner and nurses and a medical esthetician. So all these people are extremely well trained. It's not just somebody who's trained to do a procedure. They have a lot of medical background as well.
And Arleen, we have a picture of Botox, I think, that was performed on a man, and I'm interested to know, are you seeing more men looking for treatment, looking for a more youthful appearance, or trying to get rid of some of those frown lines and lines on the forehead?
Yes, we do see a fair amount of men. We would like to see more.
Yeah.
and it works very well. Botox works very well, and especially in the forehead for the man.
I would think. And if they have 2 treatments, then after that second one, it can last up to a year.
But not Botox.
Oh, not
lasts
Botox.
about 5 to 6 months.
Okay, so half a year. It's the
Yes.
fillers then
fillers
that
can
last
last
up
longer,
to
'cause
a
they-
year.
right.
Okay.
Built on.
And
Yeah.
Arleen, describe how a general consultation goes, because people can come in and talk to you about
We
what's
off-
going on with them,
Yes,
right?
yes, we offer free consultations. They can come in, we will evaluate their skin and put them on a customized regimen of products and offer our recommendations if it's fillers or Botox or photo rejuvenation to even out the skin tone, to tighten the skin. So we can do whatever they want, whatever their needs are.
And that's great that you can assess that. You also have a special offer for Morning Blend viewers this morning.
Yes, we do. For the month of July, if somebody calls and says they've seen us on the Morning Blend, we will give them $50 off any filler that they choose. So any syringe, for instance, if they need more than one syringe or dose of the filler to get the wrinkles taken care of, they'll have $50 off each of those syringes.
That's a very nice offer. Thank you so much.
You're welcome.
And we've had the information up on our screen and how people can get in touch with you. And be sure to mention the Morning Blend when you do call so that you can take advantage of that special offer. Ladies, thank you so much for being with us this morning.
Thank you. Thank you very much.
Thank you.
Well, speaking of